All right, Vanessa, I turn it over to you.
Hello, everyone. Welcome to the Impacts of Substance Use on Mental Health webinar with Kids Mental Health Pierce County. I'm really excited to welcome Becky Colon Rivera. She's a duly licensed independent clinical social worker and substance abuse professional in both Washington and North Carolina. She's a co-occurring behavioral health director at Consejo Counseling, where she's working to develop a co-occurring program, which we are all so excited about. She received her master's in social work with a concentration in children and family and a certificate in substance abuse from Fayetteville State University. So migrated all the way up to us, which we're so happy about that. Becky aided in creating a Suboxone program to work with clients suffering from the opioid pandemic and has primarily worked with the Hispanic community. Kids Mental Health Pierce County are so excited to have her here to share, focusing on the impacts of what we're seeing across our county and across the country. So I am going to turn it over to you, Becky. Welcome and thank you for being here to share with us.
As I go, if you guys want to type in your questions, I'll kind of answer them as I go, just so that the questions are getting answered in the moment, and we don't forget any questions. So what you guys have on your screens is the national drug-involved overdoses over the last 22 years. What we've seen as a nation kind of about the increases in overdoses over the last couple of years, specifically over the last 10 years. And as we see, it's been impacted more on males versus females. 2 times a higher rate. But then I went so I went ahead and looked at what Pierce County was seeing as far as overdose rates, specifically those with fentanyl, over the last couple of years. And the Pierce County Medical Examiner recorded nearly 4 times as many fentanyl deaths in 2021 versus those in 2019. And then when they just looked at Q1 and Q2 of 2021 and they compared it to 2022, they had already seen an increase of 80%. Unfortunately, the data for Q3s and Q4s, which is like July through December, hasn't yet been published. So that's where the data is up right now, where already from last year, there was an 80% increase. And then when we look at specifically at what age groups are we seeing this in? So between January of 2020 and June of 2022, at least 60 young adults and youth died from fentanyl overdoses in Pierce County. The medical examiner is investigating deaths still at this time, so this number could go up at any moment once the research for last year is all culminated. But 4 of those 60 youth that passed away were from the ages of 0 to 17. And that was in the first half of 2022. Just to be even more current, in January, we had 3 middle school overdoses within like a 2-week time period. And one of those overdoses resulted in death. Of how young the population is getting compared to when the opioid pandemic started. And substance abuse really started to come into the limelight really within the last 10 years. The population just keeps getting younger and younger of those who are starting to use and getting their hands on the substances. When we look at demographics, a lot of times there is this impression that, all races and ethnicities are all experiencing this different. So when we look at the Healthy Youth Survey that was completed in 2021 here in Pierce County, demographic and ethnic wise, there really wasn't much of a difference as how these kids are feeling and when they're experiencing the sad and hopelessness feelings. It's kind of all across the board. They're probably all about kind of average, with the American Indian and Asian and Alaska Natives experiencing at higher rates. But really when we start to see those disparities and those differences, when we look at genders and sexuality, in gender, females are experiencing it at 2 times more likely than their male counterparts. And in sexuality, those that identifies for the LGBTQ plus community also experience it at 2 and sometimes even 3 times more than their heterosexual classmates. At the time that the Healthy Youth Survey was conducted, though, there wasn't a difference in gender as far as male and female, non-binary. It was just, the question was just posed as male and female. So when it's redone in 2023, those are some of the conversations that are forming, is how to change some of that language to be more inclusive. But as of right now, that's where we're seeing the biggest disparities, is in females and in the LGBTQ plus population. So when we look at specifically at what are those indicators that kids are saying, hey, like this is kind of the stuff to be aware of. We saw that 69% of them reported nervous and anxious within the past 2 weeks. And then 58% were unable to stop their worrying within those past 2 weeks. And that's just in a 2-week time period. But when they looked at a year prior, which is coming out of COVID, all of that situation was happening, 42% of them felt that they had felt hopeless or sad within that past year. 23% of them actually considered suicide. 18 made a suicide plan, and then 10 actually attempted suicide. And then 15% felt they had no adult to turn to during this time. Studies are kind of saying that this is going to change as kids are now back in school. They're back around familiar adults. They're back around teachers and counselors who support them more, who kind of know them better sometimes than even their parents, because they spend more majority of their time at school. So hopefully we'll see a decrease in that 15%. But that year from like mid-June through the time of the study, there was a higher increase than in years prior of the feelings of just sadness and hopelessness and the what do I do. And when we compare that to the thoughts of suicide, even though there was kind of like a decrease from 2018 to 2021, there was still more than 10% of sophomores who had attempted or at least considered suicide. And the increase of them feeling hopeless and sad was still there with above 40%. I included this because even though it's not correlated to substance use, a lot of times when we think about interpersonal violence, we think about it, that's something that happens to adults. Kids aren't experiencing this, but in Pierce County in the state, 10% of the sophomores, 74% stated that they felt threatened or felt they had limitations because of their dating partner. And 71% said that they felt that their partner had hurt them on purpose physically. So even though it's something that we think about as this doesn't happen to youth, sometimes we don't even really talk about it with our youth. It's something that is happening and something that we need to be more cognizant about when we're working with our youth population, because sometimes those feelings of sad and hopelessness aren't just about their parents or their friends. It can even be stuff that's happening in their relationships, and it doesn't matter the gender or their sexual identity, just that interpersonal violence that could be happening in their relationships, and just something to talk about with them about what's going on within that partnership. So then when we look at substance use specifically, we usually see the kids usually fall into 3 different diagnoses. So it's usually alcohol, cannabis, and opioid. On your screen, you're seeing the DSM criteria. For alcohol, we usually see that it starts at really young ages, as young as 8, but usually that early middle school time period is when they kind of start experimenting with alcohol. Maybe parents left a bottle on the table, or, hey, I know our parents hide this stuff. Especially when it's not something that's used regularly, where it's going to be harder to detect if it's actually being used or not, is when kids start to kind of gravitate towards it. They will start to hide it. They'll put it sometimes in their water bottles. And especially if it's clear alcohol, then, a lot of times it can just be passed off as water. And as parents, we won't even realize, or as providers. A lot of times when we see our youth that are using alcohol, it's not separate. Like they are using alcohol with something else. Very rarely with the youth that we're seeing now is alcohol the only thing that they're using. There's usually other stuff attributed to it. And the biggest thing that I could say is recognizing, hey, like this might be a problem if it's affecting any part of their life. So sometimes, we have these 11 criteria that they have to meet and all this stuff, but really if it's affecting any part of their school, any part of their home life, it's an issue, especially at the ages that we're seeing it at. With cannabis use disorder, our kind of harder part as providers in getting kids to realize the effects of it is because it is legal in Washington. Washington having this view of, well, if I stop now, I'll just pick it up when I'm 21. But really not understanding that while cannabis can be used to treat some medical conditions, if you already have anxiety or you already have depression, it can actually exacerbate those feelings. It can exacerbate the anxiousness and the worriedness, and you no longer feel calm, and you're kind of always like on edge. It could be exacerbating those symptoms. Usually the way that children and youth enter treatment is because they're being caught at school. So they're bringing the substance to school. Somehow someone at school is finding out, and that's how they're being targeted, and that's how they're being caught to enter treatment. I think the biggest misconstrued of this is that instead of treating the substance as a, you have a problem, let's help you, how we would depression or anxiety, we're kind of treating it more as a behavior. This is something you should be punished for. This is something that a suspension is just going to fix, right? But that's not the cure-all for all of it. Sometimes the kids do need more treatment. They do need to be in a treatment setting. They need to be seeing a counselor regularly versus it just being, hey, here's your 10-day suspension. After that, come back. Or even, we're going to refer you to get treatment, but you have to follow up with the treatment. Sometimes we see that often where the children are coming, the youth is coming to get their assessment, but because treatment's not being mandated afterward, then, they have 2-3 more visits at school that usually will terminate in an expulsion from school with cannabis comes into play. And then at least out in East Pierce County, out in Grand, where we're located, we are starting to see a more rise of kids using opioids, painkillers, which wasn't really the case a couple of years ago, was still something, it was like a Tacoma thing, right? But now it's we're starting to see it more in these rural parts of East Pierce County. With opioids, the way they're getting to it, parents had a surgery, kind of left the pills, didn't consume it all, and kids are getting a hold of it that way. And later on, you'll see how kids are actually purchasing these stuff and how convenient it is for them to get it in today's technology. So when we look at usage, again, that sophomore population is a section that I try to stick to. 23% of sophomores reported that within a 30-day time period of the administration of the Healthy Youth Survey that they had used some kind of substance, with 7% reporting alcohol and 7% using marijuana as a substance they had used. But even talking about prescription pills, over-the-drug counter drug medication, and other illegal drug use as well. And then when we look at specifically suicide as it pertains to those who had used a substance, 42% of those who said that they had consumed alcohol reported that they had at least considered suicide. Two of the primary things that we have to think about is how substance and mental health are the same and not they're separate. So just a tad bit kind of off to the side. So coming from North Carolina, where substance abuse is just part of mental health, it's all treated as one thing, to moving to Washington, where it is still kind of very siloed, very mental health, substance abuse, kind of this versus thing. Just retraining our train of thought to thinking, no, this is all one situation. The kid or the youth is using for a reason and not just using because it's cool. A lot of times the kids know that smoking weed or using alcohol is not cool, and they're very aware of it. They will tell you, I'm using because there's something going on, even if they don't want to be honest about it. And again, it's, at the school level, realizing that we can't handle it as a behavior, something that needs to be fixed. It's something that needs to be evaluated and treated, because there might be other potential harm factors that are contributing to the use and the increase in use that we're seeing across Pierce County. So then how are kids getting it? With their phones is usually the primary way that we're seeing it. Our youth counselors here at Consejo have such a good relationship with their kids that they've asked, how do you get a hold of this? Can you show me? It seems like Snapchat is probably one of the more go-tos just because the messages erase. Also, Instagram has a hidden message thing when you DM someone where you can write the message, and after the person views it, the message just kind of disappears. So as parents and as providers, if we don't know these things, we're not going to know. Once it disappears, there's no way of bringing it back. Even on Facebook, there's a secret hidden message system that the kids can use. We had a kid recently tell us that on their iPhone Notes app, there was just a note going on with 30 plus people where the person supplying the drugs was on there, and all they had to do was respond, say, hey, I need something. And once the dealer saw it, he would just erase it. So it was kind of just this blank note that was on their phone, that if we looked at their phone, we wouldn't think nothing of it unless there was a conversation being typed, and we saw the actual conversation, and the youth was telling us that the dealer's pretty good about going in there and looking at it fast enough so that if someone was to grab the kid's phone, they wouldn't see it. And Twitter is another very popular one where the kids will just add each other and they'll be like, hey, and they'll put the handle, I'm looking for this, or they'll even use emojis to signify what they're looking for and what they're asking for. And then how they're paying for it, because everything is so digital now as far as money, the kids, that's what they use. They use Apple Pay, Android Pay, Venmo, Zelle, Cash App. These, I feel like maybe 5-10 years ago, you had to carry around cash to buy drugs, and nowadays you don't. I think dealers feel like at this point take anything and everything. As long as they're getting paid, they could care less how they're getting paid. And then, so I got this off the DEA website, and it's common emojis that are used for kids when they're trying to solicit or they're trying to sell and say, hey, this is what I have on hand. I remember maybe 5-6 years ago, the DEA came out with a list of acronyms and with a list of like little shorthands that kids were using. So now they've already started to use emojis. If you can see, different drugs will have different emojis that go with them. So like the little electrical plug, since the dealer's usually known as a plug, the dealer will advertise himself with like a little plug symbol. They'll use the Canadian mobile leaf to unify that they have any kinds of drugs. A cookie, that means they have a large batch, they have a lot amount on them. And then this is where kind of knowing some of the more street terms helps with understanding the emojis that come into play. Cocaine is often referred to as snow, so we'll use little snowflakes or a snowman. MDA and Molly is because they come in pill format. That's most of the common used as a little pill. But even for like Adderall, a substance that we don't think that kids would abuse, because of the counter effects that Adderall has on those who don't have ADHD, it kind of gives those who don't have ADHD kind of like this high feeling. It's a well sought out drug, especially in the university towns, because of its help and how easily available it is. We know plenty of kids who are prescribed Adderall by Vance, and we don't really think twice about it. But we're starting to see more, especially that 16, 17 age population that are becoming dependent on Adderall because it gets them high. Since they don't have ADHD, it kind of makes them a high feeling and it's so easily accessible. Stuff like Xanax, Percocets, oxycodones, I think have gotten so known to being abused. They're a lot harder to come by. So the kids are just finding different ways that they can get these medications to get that high feeling. Out in Pierce County, we see more meth use in those more rural towns versus maybe what we see in Tacoma or even in King County. Does anyone have any questions?
I've been keeping an eye on the chat, the Q&A. I haven't seen anything yet. So when I do, I will absolutely let you know.
So that's all I have. I wanted to keep it short. I didn't want to bombard you guys with a lot of information. A lot of what I think as providers, it seems like everyone's a provider, is just having those really open conversations with the parents that we see with the adult population of, sometimes the substance use isn't just I want to be cool, I want to be like my friends. Oftentimes there's more behind it. There's a big push to study ACEs, adverse childhood experiences and their effects and how they're affecting, and the pattern that we see with the connection of those early ACEs to drug and alcohol usage. As a nation, I think youth was very understudied when it comes to substance abuse. And especially since COVID and the increases that they've seen across the nation, it's been more of a big push to more study that population of kids. Maybe it was late last year, there was a kid in Connecticut who had the amounts of fentanyl that were outstanding to police, and they actually searched his room, and he was a 13-year-old. We see that sometimes. There was a case also in Florida that came out about it. But here in Pierce County, we've definitely seen an increase within that middle school population that we are now serving more and more of, where maybe 2 years ago was more just that older high school population. The ages of use are getting lower and lower. And a lot of times we're seeing that it's directly related to their depression, to their anxiety, to this, I want to feel better, so this is the way I'm going to feel better, versus talking about my feelings. kind of mentality that we're seeing.
Thank you, Becky. I have a question and I want to open it up to other folks to add questions in the chat. We are in webinar mode, so you'll have to add them in the chat or question and answer. Do you have any advice for helping professionals, school staff, other staff for helping connect young folks in our community specifically to substance use resources? You talked about how they're separate and siloed, and I think lots of us have experienced that. So do you have any advice for helping to support connection to appropriate resources?
So I guess it depends where you're at in Pierce County, will depend what you have access to. I think, sometimes so I know Consejo has an agent, that Consejo has youth programs. I've heard Greater Lakes has youth programs too for substance use. I think the biggest thing is really getting the kid on board to treatment. Because as providers, sometimes we do all this research to find the agencies that have the resources, but if the kid is not on board, it's going to be harder because of federal statutes in Washington laws. After kids over the age of 13, the parents' hands are kind of tied on what they can help with. So really, it's just getting the kid to first see that, hey, like this might be an issue, this might be a problem. Let's get you the services so that he or she can be on board to get the treatment.
Thank you. I think that's really important to know. Are there any other questions popping in, Gina?
There was a raised hand. I also see there's a Q&A. Somebody said this is very helpful information. As a GAL, thank you. And there was an inquiry about if you will be sharing your slides, Becky.
Yeah, I can send them to you, Vanessa, and then you can share them out.
Great. And then I am also seeing a question from Bervin about how can we work with you on this?
So one of the things that I'm doing right now, I'm just honestly gathering a lot of research and a lot of data-driven material. We are still kind of catching up. So November of 2022, the WAC changed all of their stuff. So we're still kind of playing catch up to all the language and the stuff that they modified. But really it's just, I can share Vanessa, if you don't mind sharing my email. I'm still collecting a lot of data and a lot of research to see where these holes are in the community, on how we can integrate both services together and kind of build a team around the kid or the youth and even adults versus it just being they have this one system that's helping with their SUD and this other system that's helping with mental health.
Great. And Bervin also had put in the Q&A about a new community engagement manager with Tacoma PD. Is there anything that you can speak to about that, Becky?
I have not heard about that. Or is that the agency that they work with?
Well, I do know that it looks like Bervin would love to work with you on a kid fair before the school year ends, and Vanessa, proactive as always, dropped your email in the chat, Becky, so that Bervin can connect with you. So that's a great opportunity also. I love it coming together. Oh, Bervin, thank you for correcting me. I appreciate that. I also see from Jennifer Colgan a question about any local Alateen groups. I've only seen groups in Tacoma.
That's all I found is groups in Tacoma. I've seen that they're having some virtually, but out here in Pierce County, I haven't seen any. We partnered in the past with Recovery Cafe out in Orting for groups, and they do some stuff depending on the time of year. They'll do groups and stuff, but that's the only organization I've seen out here in like Eastern Pierce County that's doing stuff outside of Tacoma.
Great, thank you. So far, those were all the questions that I'm seeing. Oh, wait, one more. Bervin has dropped a phone number, which we will make sure that we get you, Becky, so that you guys can connect and talk about ideas. Look at that live collaboration happening everywhere. I'm going to make sure, Becky, that it gets dropped in the chat, your contact info, and I'll make sure that we get you that phone number.
Thank you very much, Becky, I think that these ongoing conversations and the community collaboration, even that we're seeing live, is the most important part. Kids Mental Health Pierce County being a coalition of agencies and providers that want to work together to do our best to improve mental health and substance use support for young folks in our community. And we are looking at doing that live right now. So thank you so much for being here. Thank you, attendees. Thank you, everyone. We will have this recorded on our website. And if anyone's interested in connecting further, I will have the information for email address provided. And I'm always open to additional supports and resources for these ongoing conversations. So if anyone has ideas or questions for future webinars or ongoing conversations, I know this is a passion of Becky's, doing this research, doing this work. We can continue these conversations as our work is never done. I appreciate you all. Becky, thank you so much for being here.
Thank you for having
Kids
me.
Mental Health Pierce County, so grateful to all the work being done in our community. So thank you all very much. And we will see you next month.
Have a good day.
Thank you, everybody. Bye-bye.